Society judges us very much by how we look, and more these days there is a pressure to have a fresh, relaxed and vital look about you. And we try as hard as we can to keep ourselves looking good by eating well, living healthy lifestyles, but sometimes we need a little bit of assistance. So we've invited Dr. Mark Opperman in studio to help us shed some light on medical aesthetics and some of the treatments that are available. Mark, welcome. Good to have you with us.
Thank you.
So Mark, I mean, there's a distinction between looking fresh and rejuvenated and then, of course, sort of overdoing it. There are extreme invasive procedures to make ourselves look younger, better, different, whatever it might be. But what are the ones that are going to be sort of subtle enough that we're going to look in the mirror and feel, do you know what? I'm alive, I'm fresh, I don't look like I'm haggard and tired and dragging.
Michael, I've been practicing aesthetics for more than 22 years, and there's two standout treatments that have stood the test of time. The one is your neuromodulators. People will know this as Botox. I just want to clarify that Botox is a registered trade and brand name, just like Panado. It's botulinum toxin treatments. In South Africa, we have three. We have Dysport, we have Botox, and we have Opperman. So those are your neuromodulators. People actually don't really know what neurotoxins do. Literally, this is a treatment that decreases muscle contraction.
Okay.
So it stops the electrical impulse from the nerve to the muscle, and therefore the muscle doesn't contract, and we don't form those dynamic lines.
Okay.
In other words, these are the lines between the eyebrows, those 11s, those angry 11s, the crow's feet or laugh lines around the ear, and the forehead lines.
All right.
What people don't understand is that this is one of the most safe treatments that you can do.
Okay.
For one simple reason: nothing that we do with a botulinum neuromodulator is permanent. The moment that the nerve ending is inactivated, and that's what it does, the body regenerates a new one.
Okay.
So, you know what, if there's a problem, it will reverse itself over time.
Yes.
The treatments are quick and easy, it's fairly painless. But what we need to understand from a neuromodulator is that the effect takes a little bit of time to start showing. So, you will do a treatment, maximum onset of action for most of these products, 10 to 14 days after initial treatment. And longevity, anything between 3 to 4 months. Depending on your dose, if you do a smaller dose, your longevity will be a little bit shorter.
Beyond the neuromodulators, what are the other sort of treatments that we can be looking at?
So here we're looking at our tissue fillers. Now, tissue fillers, think of it as polyfiller for the face, where we have deep lines and wrinkles, or where we have volume loss, we will use a tissue filler in the majority of cases. Tissue fillers, usually hyaluronic acid products. Hyaluronic acid, natural part of skin, forms part of the extracellular matrix. The tissue fillers gives us volume and structure to the face. There's different types of these tissue fillers, each with its own unique characteristics, and according to the problem that you're trying to treat, you will choose your filler. So the most common places where we use it in younger patients, specifically younger girls, we look at lip beautification or slight lip augmentation. We can use it for a slightly older patient. We start using it in the mid-face, where we start seeing sagging and volume loss. We can use it for definition, jaw lines, noses in specific cases, if you have a good injector, augmentation of the chin for guys, etc., etc. More specialist treatments are treating of a tear troughs. At some point, we'll take a look at those. And you know, it's all about understanding how the anatomy, the underlying anatomy of the face have changed. whether it's bony deformation, whether it's support tissue like fat pads or muscles, and that will allow you to decide which product am I going to use and where am I going to place that.
Okay.
But I think it's something for a next
right.
Episode. The new product, it stood the test of time. It's been on the market for 25 years. Those are your biostimulators.
Okay.
In South Africa, they're fairly new, but they've taken the industry by storm. It's one of my favorite treatments to do. As we age, we start losing collagen in the skin.
Yes.
Collagen is there to provide structure and strength to the skin. So think about it. If you start breaking down the scaffolding of the skin is going to show signs of aging. Here we're looking at laxity in the skin, and that's literally when you pull your skin away like a rubber band.
Okay, so that's so when you say so, it's pulling it away,
it's
how
a pinch
bounces
test.
back.
Yes.
Okay. Okay.
If you can take a look at my neck, it pulls.
Yes.
If I pull my cheek, it doesn't pull.
Yes.
Okay, so I have laxity here, but I don't have laxity
Okay.
in my face. Sagging of the skin, everyone does that instant morning facelift in front of a mirror. If only I can do this. So your biostimulators will address that condition because it's collagen loss that causes it.
Okay.
They also lead to natural volumization in a face. So instead of overdoing, it creates natural volume, and we'll see it in one of our case studies. And then it also addresses luminosity of the skin.
Right.
So as we start losing collagen, as we start losing elastin, that pigmented areas becomes more superficial because the skin is thinner.
Okay.
So your biostimulators, wonderful product.
Okay.
The wonderful thing about this, it's biocompatible, it's biodegradable. It breaks down into water and carbon dioxide. So for your patients that do not want something foreign in their faces, this is a phenomenal treatment.
Right.
Beautiful, natural, long-lasting results.
Okay. Absolutely.
We have other treatment modalities, specifically for skin. Here we're thinking of our energy and light-based devices, radio frequency, laser, etc., etc. For old treatments like your chemical peeling, mechanical injury, microneedling, etc., by combining all of these treatments together, you can really give a patient a refreshed, healthy, rested look. Okay. And in my practice, that's what we focus on.
Wonderful. Mark, we're going to, as I said, delve into a couple of case studies. I'm very interested to see how the effect of what these processes have on the face. But in the meantime, anyone who might want to get in touch with you, remind us again where they can get hold of you.
So the telephone number to call is 010-824-1393. We're based here in Bryanston, Johannesburg. And the website is www.tclinic.com. There's an aesthetic section on the landing page.
Great stuff. Mark, thank you so much. Looking forward to our next chat next week.
Thanks, Michael.